So we're told that 11% of the world population live here in Africa. World Health Organization study indicates that Africa has 24% of the global disease burden. The continent gets only 1% of global health expenditure. The need for quality and accessible healthcare is critical for Ghana to achieve the targets of the Sustainable Development Goals. And we've had many conversations because obviously we have a lot of health challenges, but there seems to be a way that is being recommended now that we will get to understand. It will probably help solve significantly the challenges that we have. Just want to leave the rest to my guests for that conversation to begin. So Dr. Wisdom Amaglator is Secretary of the Healthcare Federation of Ghana. And then Mrs. Paru Bajrajakana is General Manager, Healthcare Federation of Ghana. Yes, good morning to you.
Good morning. Good morning.
Okay, so what is this agenda? What is this? First of all, tell us about the Federation.
So do you want to start?
Okay, I'll start.
Yeah.
Well, the Federation, I would say, came about because of the pioneering role of mostly some few Ghanaian medical businessmen and then our donor partners who thought that we needed to create an environment for medical businesses within the country to see how we could come together to create a partnership or a network which can effectively partner with the government to help solve most of the numerous challenges facing healthcare in the country.
Let's outline a few of those. Let's see if we're all on the same page.
Okay, so I'll take that first.
Okay.
So the few challenges that Ghana, not only Ghana, Africa as a continent, it's at a turning point where healthcare reforms are happening, and the decisions that the government takes right now, the policies, the reforms, they will be crucial in the coming generations for the people. And if I may say so, the way we design our healthcare system says a lot about us, our identities as a society. The few challenges that we are facing now are regarding the human resources in healthcare, the workforce, the healthcare financing, the investment, the digital technologies that are coming up, so we need to keep up with those, and the supply chain management. Yeah, these are a few.
So essentially, has this worked anywhere else in terms of us getting all these people involved in healthcare together under one big umbrella? Have we seen it work elsewhere?
All over Africa, actually. So Healthcare Federation of Ghana will be part of this continental movement that's going on. So there's already an Africa Healthcare Federation that has sub-regional federations involving West Africa, East Africa, Central, Northern, and Southern. So Healthcare Federation of Ghana will be part of the West Africa Healthcare Federation, in turn under the Africa Healthcare Federation. So West Africa already has 9 West African countries involved. So the movement has picked up, like it's all over the continent. Yeah.
Can you tell us? Yeah. Can you tell us how?
To add that it's unfortunate. We are rather behind. Ghana, we are behind.
Right.
The West African Federation, we have Nigeria, Ivory Coast, Togo,
Burkina Faso,
Benin, Burkina Faso, and Ghana. Also, we are now trying to join.
So now we are stepping into the zone there.
So what's been, let's take the Nigerian situation, because we're very familiar with Nigeria. What has worked with the coming into force of this federation, you would say?
Well, I could say with Nigeria, they have built a very strong platform. At our last meeting where we met in Accra, the hospital expansion project, I met some colleagues from Nigeria, where now currently in Nigeria, the government has handed over the management of some of their teaching hospitals, the university, to private industry players. It's like in Ghana. Purely private. Like Ghana here. Kolebu being managed by a private entity, which will ensure will be giving benchmarks, and then they will be given deliverables from which they will be judged on. So that's how far Nigeria has gone.
Yeah.
Even though they might have their challenges, they have made quite some significant progress.
Because of course we know how the private sector runs, and we always kind of compare. Even with insurance, even with this whole system where now we're trying to go digital with the facilities, but we know that some of the private hospitals, in fact, I think almost all of them have done really well and they are still advancing, whilst the public ones are now even beginning to think of going the technological way. But there are reasons why some things are in the hands of government and some things are in the hands of private people. Wouldn't there be a conflict? There are issues with, government, they know their people. They want to mitigate and try and step in sometimes. If it's solely in the hands of a private person, they'll be thinking about making
the
profits.
Money. I know that's the perception of people, that private, healthcare players are all about the money. But I wouldn't I wouldn't say that. So our main purpose is actually to unite the two systems. The healthcare system worldwide is divided into public healthcare and the private healthcare. So our intention is bring the two together, because to bring productive and constructive healthcare change, we don't need to fight the systems. We just need to unite the two systems. And once they're united, and the main strategy will be the public-private partnership. And once they are united, they could improve the healthcare delivery system. There could be a huge transformation there. They could help deliver what we saw. We'll use this term very loosely, sustainable healthcare. Once these two systems, the private and public unite, that's when we can actually achieve sustainable healthcare delivery system and eventually, hopefully, the universal healthcare coverage goal that we're looking at. Because you basically need to unite the competencies and the strengths of both the systems. We've been seeing that private sector has the means, the resources to look after the financials, the operationals, the technical know-how. So they have those sort of expertise. And it's not necessary for the public healthcare sector to bear the burden alone. We can all work together. And once we work together, then hopefully there will be a good change. There will be a huge transformation.
In Ghana, some of the places, some of the areas that record incidents that sometimes you kind of wish that there was something you could do, mostly in the rural areas. How would this improve the situation in some of these deprived areas?
Yes. For the rural area, first, let me just go back about this thing about private, how could private and public work. I think this construct of private-public is something we have created in our own minds. Because Ghanaians, the private sector and the public sector, we all see Ghanaians. We don't have private Ghanaians and public Ghanaians.
No, we said the private is more expensive. Yes. And when you go to the private, you get to spend a lot more time with the doctor. You can ask any question you want. But in the public, there's a long queue.
The waiting time.
Yes, it's because of the segments of the markets that they target. But Ghana here, we have a very unique opportunity with the National Health Insurance scheme. It's very unique. You see, I always say that Ghana, we copied so much from our colonial masters. Unfortunately, we decided to ignore the very thing that the British did so well, which is their health system. The NHIS, today in the whole world, is touted as the very best. But we ignored it. And how does it work? It works with a system. Primary care in the UK is handled by general practitioners all over. And this general, today, as we speak in this country, we have unemployed doctors. If we were to use the NHIS, instead of focusing on just, NHIS, free medical care for the people, and think in a strategic way that how can we leverage this thing to solve other problems? We will be able to get our doctors employed. And those doctors, the problem about these charges, inequity of charges, the private healthcare charges higher. Now, we have private sector players who are doing NHIS. So if in the rural areas, a doctor could be incentivized to set up in the rural area, and then he knows that, I get some tariff, he gets some rates, preferential rates for that area. I'm sure many doctors will go in there. They will be taking off the government payroll. Those doctors will employ people. The multiplier effects are just unimaginable. But unfortunately, we focus on the very narrow part, free healthcare for the people. And then we have who did it, who is not making it work. We should move beyond that. Let's be strategic. Let's think ahead. How can we build the synergies? If we put health insurance, make sure we are paying health insurance on time, those doctors will get employed, nurses will get employed, we employ cleaners, orderlies, so the effect is a multiplier effect.
Paro, how does the federation work, or at least intends to, with the Ghana situation?
So like I mentioned before, we are trying to bring the two sectors together. And if I may add to what Dr. Wisdom just said, it is, we should stop discriminating each other in the sense, describing one as a player of private and one as a player of public. We should just be one. We belong to the healthcare community. It's a service industry, and we are here to provide for the people. And when I said sustainable, it should be more about the affordability, because you just asked him that. That's what healthcare should be about, because it shouldn't push a person to bankruptcy because of the burden of the medical bills. It should not just be for the rich. It shouldn't, healthcare should be for everyone.
Should be basic.
Exactly. So even for the poor and underprivileged, it should be accessible and affordable. In spite of the social strata, that is not something we should be looking at. So if we stop looking at that and we make it affordable, accessible for everyone, you'll see a change, not only in the health of the people, but even in the economy of the country, because that will be affected in a good way a lot if the healthcare reforms are brought in.
Okay, so back to who are you roping in under this big umbrella?
So Healthcare Federation of Ghana, it recognizes the institutions who are already into healthcare, belonging to preventive, curative, palliative, rehabilitative, everyone. It's not just for one, not just for manufacturers or not just for distributors. It's for everyone in the healthcare industry.
Whether it's public or private?
Yes, yeah.
Okay.
And we just to add, we are not talking about the orthodox medicines here. We are even talking about the herbal practitioners. What we want to do, we want to bring, see the private sector, the problem with the private sector is that there's a World Bank report, they describe it as a black box. You see, there's a lack of transparency. You see individual players, everybody doing their own thing somewhere. So, but we want to bring them all together. As a federation, we want to self-police ourselves. The herbal medicine practitioners, we want to bring them on board. Now, we want to make sure your production processes, do they stand up to standards? And then if not, how can we help them to get their acts together? We bring everybody from even the fitness groups,
The wellness,
wellness groups, everybody from that myself, from preventive, curative, rehabilitative, and everybody in the healthcare. If you have anything to do with human life,
even those who are just promoting healthcare, even promotive, I forgot to say that.
Okay, so how has the response been?
Oh, it's been massive. With people, a lot of people, and the difference about this one is that it's not dealing with individuals. We are moving away from individuals. Previously, we have associations, businesses, but they were individuals. Sometimes, and most of these things are when that person passes away, the person loses interest, the whole thing fizzles out. This one, we are talking about businesses. So it becomes, so even if the person passes away, since the business is a perpetual entity, it still survives. And then,
so what happens to these entities that are already in groups? So you have one group or the other. Is it, do you want the groups to join, or you still want the individual entities?
no,
We are focusing, sorry, I interrupted. No, we are focusing more on the organizations. There could be a person, it could be an individual, but they should belong to an organization, an institution. We wouldn't want to focus on just an individual.
Okay.
Yeah.
Okay. And then the benefits to these people who join the federation?
Well, the benefits, first, we can then be able to lobby government, because for me, I personally think, why should those of us in the healthcare industry be paying taxes? We can be giving tax breaks, because when that money which we are giving back to government, we are going to reinvest it in equipment and other things to keep on providing better healthcare. We will be able to even influence a tool to influence policy decisions by the government. The public-private partnership thing, we have it over there, but it's not working. But we will have to push that agenda. So on the whole, I think that If we come together, we become stronger, and we will have a bigger say and a bigger influence in how healthcare is delivered in this country, because we are also part of this country. Healthcare concerns us. It's our industry, and there's nobody else. The president said we should take care of our own destiny. We should take charge of our own.
Recently, there was a manufacturing company, a distributor, a foreign one, that had worked with local businesses, pharmaceutical businesses, I think for a very, very long time, but they suddenly got one new person that emerged, and they decided to stop the others from now being distributors. And I'm thinking that if this existed, if they were part of this group, because then they wrote articles and tried to get their voices, heard. But then there was also the fear that if I go really all out, I could be victimized because I'm just a business and I want to survive, but I also want to fight
exactly,
this.
You're right. This federation will actually help people build their businesses. It will make them feel protective because they'll be around the same kind of people who are into same field, right? And obviously there's no question of being victimized then. So, I mean, they'll have a common voice. If they want to voice out something, they'll have a platform to do so, a unified platform.
So where do we begin from? I hear there's a launch coming up?
7th December.
Okay.
So it's on 7th of December at the Alisa Hotel, and the guest of honor is the health minister. So and it starts at 10:30 a.m.
What does he think? Have you had time? What does he think about this?
He's very supportive.
He's
very keen and supportive of this.
He's encouraging of the federation.
And, you know, he is a renowned financial person, so he knows the implications of all these things. So he's been very, very supportive.
But for me, also as a journalist, I want to be able to come to the federation when there are issues with some of your members. And if I can be assured that you will talk, because sometimes when things come up, there's nobody to talk to. You know, and then you can't go with your story because it means that it's not fully cooked.
No, we'll definitely make you a part of it somehow.
that is one of the reasons why we are forming. This is one of the reasons of this federation, that we will self-police ourselves. If maybe a member is doing something which is unethical or below board, we'll be able to call that person to order and tell the person, put your hands together, or we will come out and expose you.
Okay. All right. So finally, what would you like to say just before we wrap up?
Well, I would like to say support the federation. Whoever wants to be a member, you can contact us. The contact details are on the advertisement. My name is there, my number is there. It's easy to contact us. We are very approachable. And if they want to attend the launch, it's at the Alisa Hotel at 10:30 a.m. on 7th of December.
Okay. All right. So there's a website, is there?
We are forming one.
Still
getting the website.
Okay. All right.
And as healthcare, united we stand. So if we unite, we'll be able to stand up as the transformed healthcare system.
Definitely.
And just to add that we hope that this federation will be the beginning of something bigger, where we will be able to make sure we spread healthcare to every nook and corner of this country, and then we'll then be able, beyond that, we want to be able to reverse the medical brain drain. We'll create the environment where our doctors don't need to go outside anymore. They will become health, and they will own their own facilities, using our NHIs, work with the government to create a prosperous society. Our doctors will feel comfortable taking care of their own people instead of going to take care of other people.
And it would increase the employment too.
Sure. Grateful for your time.
Thank you.
Thanks a lot. And Dr. Wisdom Amagloto is Secretary, Healthcare Federation of Ghana. Mrs. Paru Badraja Kana is General Manager also with the Healthcare Federation of Ghana.